Hi everyone, I am Mayurika, third year medical student from University of Jaffna. Here I am going to explain about submandibular salivary gland under the session of head and neck. Under this topic we are going to see about gross anatomy of this gland, duct system, blood supply, nerve supply, lymphatic drainage and clinical significance. Let's move on the topic gross anatomy of submandibular salivary gland. It's a mixed type of gland. It secretes both mucus and serous and it's situated in the anterior part of the submandibular triangle. It has two parts. Large one is superficial part and the small one is deep part. Superficial part is connected to the deep part through the posterior free margin of the mylohyoid muscles. Now we are going to see about the superficial part. It has three surfaces: lateral, medial and inferior surface. Lateral surface lies against the submandibular fossa. Here we can see the insertion of medial pterygoid muscles in this surface and facial artery hooks under the mandible through this surface. Next, inferior surface, it's covered by skin, platysma, investing fascia. And this surface is crossed by facial vein, cervical branch of facial nerve, sometimes marginal mandibular branch of facial nerve. Submandibular lymph nodes lies within the gland in this surface. Medial surfaces lies against the mylohyoid muscles, behind on hypoglossal muscles. Here you can see lingual nerve and the hypoglossal nerve and accompanying vein are seen in this surface. Next we move on the deep part. Deep part extends forward between mylohyoid and hypoglossal muscles. You can clearly observe deep part lie below the lingual nerve above the hypoglossal nerve. Let's see the submandibular duct. It's called Walton duct. It's 5 cm in length, same as parotid duct. It emerges from medial surface of the superficial part and runs with the deep part. Then it goes forward and slightly upward between mylohyoid and hypoglossal muscles. Then it goes between sublingual gland and genioglossus muscles. And it's open into the floor of the mouth on sublingual papilla beside the frenulum of the tongue. The duct crossed by lingual nerve laterally. Then we are going to see about the blood supply of this gland. Facial artery and the facial vein is the major vessel supplies this gland. Facial artery, here you can see well. First it lies deep to the gland, then it grooves posterior superior part of this gland, then hooks over the top of the gland on its lateral surface. We already seen before the lateral surface. For the lymph drainage, submandibular lymph nodes situated within the glands. Let's see the nerve supply. Secretomotor fibers to the gland have their cell bodies in the submandibular ganglion. You can see that's hang on the lingual nerve. The preganglionic fibers pass from the superior salivary nucleus in the pons by the way of nervus intermedius, facial nerve, chorda tympani and the lingual nerve. Postganglionic fibers pass to the submandibular gland and also lingual nerve for transmission to the sublingual gland. Next, move on to the clinical significance. The glands exposed by skin crease incision about 4 cm below the mandible to avoid the damage of marginal mandibular branch of facial nerve. Removal of this gland for whatever tumors or cancers requires ligation of the facial vein which lies on the gland surface. And facial artery also need to be separated from its groove on posterior superior part of the gland. Otherwise, a small segment of the artery removed with the gland. Hypoglossal nerve and the lingual nerve must be safeguarded. Lingual nerve must protected when duct is ligated and divided. Let's see how to differentiate an enlarged submandibular gland and a massive submandibular lymph nodes. Gland not only lie below the mandible but also extend into the floor of the mouth. So it can be palpated bimanually between a finger in the mouth and a finger below the angle jaw. Enlarged lymph nodes are felt only below the angle of jaw. Stones in the Walton duct can be felt bimanually in the floor of mouth. There are some probable reasons for the stone formation in the duct. One is long duct, large caliber of duct, slightly upward flow of the saliva, and both mucus and serous secreted. That's all friends. I hope it will be useful for you. Please like the video and don't forget to click the bell button to subscribe this page. Don't miss the upcoming videos.